We are very pleased to announce the success of Project 25 at the one-year anniversary. This program is funded and facilitated by the United Way of San Diego County. It's a historic collaboration with the County of San Diego and the City of San Diego's Housing Commission. Since the project began in February 2011, St. Vincent de Paul Villages has managed and overseen the program, including customized case management for enrolled individuals. The success of Project 25 is also based on the strong partnership with dozens of organizations countywide, many of whom are present here today. The project provides permanent housing and supportive services to chronically homeless individuals who are frequent users of the system, including ambulance rides, the emergency room, inpatient hospital visits, and interaction with law enforcement, along with many other public resources. Although the program is called Project 25, we now have 35 individuals enrolled in the project and 30 have found permanent housing. While chronically homeless in 2010, the 35 participants used over $11 million in public resources, according to the data that has been collected and reviewed and approved by the Fermanian Business and Economic Institute at Point Loma Nazarene University. Since Project 25 began enrolling participants have cost taxpayers $3.4 million. So you can see the savings that exist. The average cost per participant, in case you couldn't do the math that quickly, was the average participant cost $317,000 on average in 2010 versus $97,000 in 2011 after being enrolled in the program. Project 25 is tracking and compiling the total cost of services used by each person, both before and after entering the program. This is the first comprehensive data collection in San Diego's history. The success of Project 25 has resulted in a 77% reduction in emergency room visits for these individuals, a 72% reduction in ambulance transports, a 74% reduction in inpatient medical stays, a 69% reduction in arrests, and a 43% reduction in the number of jail days. We're very excited about the success of this program at the one-year mark. We're looking forward to continuing this.
Normally, when we celebrate an anniversary, we certainly celebrate, and we have a lot to celebrate about today. Certainly those figures that Brian just talked about are phenomenal. But I think we'd be less than honest if we didn't acknowledge that we still have a lot of work left to do. And the County of San Diego is committed to this mission, working with our partners to continue this program and certainly help our most vulnerable residents. I am also very committed to this mission. It wasn't too long ago that I joined literally dozens, actually it was more like hundreds of volunteers that went out in the early morning hours to help get a better handle on our homeless population in downtown San Diego. I can tell you it was a very eye-opening experience, and it represented just a small part of the county's effort in helping the homeless. The County of San Diego has committed $400,000 each year for the next 3 years to help assist Project 25. Services being provided by the county include intensive case management, nursing, psychiatric, medication management, and substance abuse counseling, and employment assistance. Overall, the County of San Diego spends about $185 million a year in resources and services to help the homeless countywide and those at risk of becoming homeless. These resources that are helping the homeless throughout the region are not just spent in downtown San Diego, they're spent throughout the entire region, although $46 million of that $185 million is being spent in the downtown area. But let's be clear, homelessness is a complex issue. It won't be solved by throwing money at it. The progress we are seeing with Project 25 is the direct result of the growing collaboration between the County of San Diego and the City of San Diego and the Housing Commission and the other partners we have, including St. Vincent de Paul, and partners like United Way.
Last year, when the United Way approached the San Diego Housing Commission seeking our partnership in addressing the problem of chronic homelessness, and I think it took Brian all of about 30 seconds to convince me that this was an ingenious approach to take. Fortunately, the Housing Commission was in a position to step in and help because in what hasn't happened across the country quite yet, most housing authorities would not have been able to. That's because in 2010, we became one of the very first housing agencies in the nation to receive approval from HUD to use federal housing choice vouchers to place homeless individuals into long-term housing with supportive services. That's because we are one of only about 35 agencies across the country who are in that deregulated status. The Housing Commission has provided 25 of these sponsor-based federal vouchers, which have been used to stabilize the lives of these previously homeless individuals. These vouchers have become an essential component in the success of the program, and they're making a profound difference for people who are struggling not just to get their lives in order, but to simply get a roof, shelter over their heads. One thing is for sure as well, none of this would have come about without the partnerships across the board.
There are three critical factors that I'd just like to mention, and you've heard some of it today already. The first being we could not do what we do with not only short-term funding, but long-term and sustainable funding. So as we move forward, let's keep that in mind. Secondly, we also could not have the outcomes that we have without the professional staff that provide frontline passion, love, tough love, and sustained service to the population that we're serving. I just learned the other day the number of hours sometimes it takes one staff person to deal with one client. Sometimes 26 to 28 hours a week. That's a lot, and it may seem like it's not worth the money, but in the long term it is, as you hear the outcomes. And finally, cooperation and partnership between city, county, state, federal, and nonprofit entities are the only way that we can move forward in this city and beyond. So let's continue to do that.
We're fortunate to have James, who's joined us here today, who's one of the Project 25 participants, and who agreed to be present and to let a little bit of his story be told. In 2010, he took 54 ambulance rides. In 2011, he's taken one. 51 emergency room visits in 2010 versus one this year. 7 hospitalizations and 39 days in the hospital in 2010, 0 this year. 34 jail days in 2010, 1 this year. 15 detox days versus 0. James, you are a true success story, one of the many, and we really appreciate your bravery in stepping forward and allowing your story to be told.
And that was all I lived for every day, was to drink. I didn't have a goal. I didn't have, I didn't see a future. And I happened to get incarcerated in the county jail, and Project 25, Mark Stevenson approached me and told me about this program, and my first reaction was like, okay, what's the catch? I thought it was just an alcoholic program. It was sober living or whatever. And it was like, no, it's nothing like that. We're trying to get you back on your feet. And I said, okay, I'll give it a shot. And the day they handed me my keys in my own apartment, wow, it's awesome. To be able to not have to be able to sleep in a bush, sleep on a bus bench. I can wake up and I know that I'm safe.